situation in our state. From Minnesota Health Commissioner Jan Malcolm, time permitting, we will join up with our colleagues in London for the BBC NewsHour. NPR News has been airing these press briefings whenever they happen, typically at 2 o'clock, as a public service since the pandemic arrived in Minnesota some 18 months ago. State epidemiologist and Health Department Medical Director Ruth Lynfield is also scheduled to be on the call today, which will likely shed some light on a new app the state is launching to keep track of your vaccination records. That includes COVID shots, but also other inoculations as well. In other coronavirus-related news today, a Minnesota judge has rejected a request by concerned parents to force a statewide mask mandate in all schools. Roseville area schools will require staff vaccinations or weekly testing. The Roseville School Board adopted the resolution last night, with the requirement taking effect October 15th. We'll likely get some comment from the health leaders or questions from reporters on those developments. Maybe we'll get an update on new infections linked to the state fair and other large late summer gatherings. There's much more on the coronavirus online now at nprnews.org, as well as the non-COVID news we're tracking today, including the Minnesota Supreme Court reversing a third-degree murder conviction of Mohammed Noor. I hear Jan Malcolm in the background. Let's bring her on live here on NPR News.
As noted on our website, it's important to state right off the top that these totals reflect not only the normal daily figures, but also the results of a rather lengthy data review process that I'll describe shortly. Outside the retrospective cases that were confirmed through that process, we would be reporting 2,089 cases today and 13 deaths today. This brings our cumulative pandemic totals to 676,505 laboratory-confirmed cases and 7,956 Minnesotans lost to COVID-19. As of yesterday, so this does not include today's numbers, which have that caveat I just talked about, the daily average over the past week is 2,330 new reported cases per day, to be a weekly total of 16,307. This is 3,000 more cases than the week prior. As we've talked about on prior calls, overall the age distribution of cases continues to trend younger, with over 10% of cases over the last 2 months, back to early July, among children under age 10. For comparison, during the surge in November and December of 2020, the proportion of cases in this youngest age group was half of that, at 5.1% of all cases. And while this younger age distribution, frankly, is to be expected because of vaccine coverage and eligibility in the higher age groups, it's still pretty remarkable to see 10% of the recent surge burden being borne by our youngest children. Since early July, almost 6,500 children under the age of 10 have tested positive for COVID-19, with roughly 2,500 just in the past 2 weeks alone. All but 4 of Minnesota's 87 counties are listed by the CDC as having high rates of transmission. The other 4 are in the second highest category of substantial transmission. Nationally, it appears that only a small handful of counties in a couple of states have any counties in the moderate or low range. So the entire country is facing high transmission rates at this point. Testing did drop in the past week with lower testing on the Labor Day holiday, but testing rates do bounce back in the data lag period. Our statewide test positivity rate is increasing at 7.1%. The last time test positivity was above 7% was on April 15th of this year. We currently have 718 COVID patients hospitalized, including 208 in the ICU. We've not been over 700 beds, except for the last couple of days, since last April. And this is the highest number of people in ICUs in all of 2021 so far. We've been saying since the beginning of this pandemic that it is a top priority for all of us to protect the capacity of our healthcare systems to make sure people are able to get the care that they need. As we've seen, COVID cases are going up, and along with them, hospitalizations. Even before COVID cases started to rise, our hospitals were very full, with patients needing care for other critical conditions. So as more beds fill with COVID patients, there are fewer beds to allocate for any condition, COVID or otherwise. You might have seen stories recently emerging around the country about the impact of this, including a national story of a case in another state where a rest tragically died after being turned away by hospital after hospital that was over capacity due to COVID. The point of this story, beyond the tragedy of that individual and his family, illustrates just in painful clarity how one person's COVID case is not just one person's or one family's problem. Multiplied again and again, it can add up to a serious problem for all of us, even if we are not infected with the virus itself. Many of our physician leaders and hospital leaders have been making this point increasingly in recent weeks. We're seeing some of these same pressures in Minnesota hospitals that are occurring all across the country. And it is pretty remarkable how this is a shared problem across the country. We need to understand that this isn't just about the physical assets of a hospital bed or a ventilator. Well, those are the things we focused on as being the critical supply question early in the pandemic. Now it's about staffing. There are fewer healthcare workers on the job today than there were last year, even during the peak of the pandemic, due to the extreme stress and burnout that they've faced for over 18 months now. It's important that we all realize just what incredible work our healthcare providers have been doing, along with our public health workers over this long period of time. It's taken a toll, and there are fewer staff in most of our institutions than there have been for a long time. Despite the extraordinary collaborations that are happening across our whole healthcare system, it is getting harder for some hospitals to find open, staffed beds at the right level of care for critically ill patients, whether due to heart attack, stroke, or COVID. This is an issue statewide, impacting both small rural facilities and larger metro systems. MDH is closely monitoring the situation and is always in contact with our healthcare leaders about the steps they're taking to manage capacity, and they are doing a lot to prioritize care for those who need it the most critically, and about the help they need. All of us in Minnesota need to do our part to limit transmission of this virus and protect ourselves and our neighbors from the harms it can cause. That means getting vaccinated as soon as you can when you're eligible, and it means going back to some of those things we'd like to be done with but are as important now as ever, like wearing a mask when going to a public indoor setting, and things that we should be doing as good practice all the time, like staying home when sick or exposed to someone who is sick and getting tested as appropriate. And on that note, I'm pleased to report that today's figures show another 2,579 people got their first vaccine dose, and even equally importantly, 3,796 completed their vaccination series. Every vaccination makes us more resilient individually and as a community, and we want to thank Minnesotans for their close attention to these messages and to the increasing importance of these measures given the Delta variant. I'd like to give just a brief update on what we know about the State Fair and other large events, Sturgis and other things, and how important it is to limit the risk of transmission at large gatherings of any sort. And as we talked about many a time, after large public events, we usually expect to see COVID cases associated with those events, and that's certainly been the case with the 2021 State Fair. The fair ended a little over a week ago, and it will be a few weeks before we have a more comprehensive assessment of transmission associated with the fair. But as of the latest report, we now have 153 cases, including 4 hospitalizations that are directly tied to the fair. We're also tracking cases from other events such as the Sturgis Rally that was held in August. And as I think we've updated before, we have 33 Minnesota cases associated with the rally, and are also seeing cases from concerts, county fairs, and other large gatherings. We've talked about this a lot, but it's important to note that the cases that we can report are far from the complete total number of cases, because we know that not everyone who actually has a case gets tested. Sometimes people forget or omit things in the interviews with our epidemiologists who talk to confirmed positives. And at this point in the pandemic, just given the sheer volume of cases, we're just not able to reach everyone to conduct interviews for many cases. So all those things together mean that if you look at the number of cases we can report specifically for any given event, the reality is there are most likely several times as many cases actually associated with these events. And of course, each primary case that we can actually link to an event goes on to infect several other people typically, who may not be able to be linked to that event, but who got sick in part due to the exposure that happened to the primary case at the event. With the earlier strains of the virus, it was estimated that one person would infect 3 others in the next round of transmission, and so on after that. With Delta, that estimate is that one person in the next round of transmission infects 7 others, and on it goes. So you can see how that math works. That's why we continue to remind people that when people gather, transmission happens, and that a layered approach to prevention is just highly, highly recommended for any time that we're in large gatherings. Vaccination is the first and most important layer of defense against COVID. And the greater risk of exposure that you face or ones that are close to you or that you care for face, the more prevention layers you will want to use. If you or your loved ones are unvaccinated, it's particularly important to be consistent about using multiple layers of protection when we're seeing the kind of high transmission levels that we're seeing all across our state. I'd like to share some positive news for today. And that is, many of you have probably seen already the press release we put out earlier in the day announcing a new phone-based application called Docket. This is a tool to help Minnesotans more easily access their immunization record through their smartphones or other mobile devices. Docket enables residents who have a record, an immunization record, in our Minnesota Immunization Information Connection, or MIC. So residents who have a record in MIC will now be able to securely view and share their immunization records through this app. So Minnesota's Immunization Information System, again called MIC, combines all the immunizations a person has received into a single record, even if those vaccinations were given by different healthcare providers in Minnesota for different types of vaccinations. But starting today, anyone who has a record in MIC can use the Docket app to access their record, which would include their COVID-19 vaccination. The app provides a PDF document of the person's immunization record that can be saved to the mobile device, printed, emailed, or texted as needed. Docket helps meet the rising public demand we've been seeing for more accessible immunization records. Until now, Minnesotans wanting their MIC record needed to go to the MDH website and fill out a request form. That process worked fine when we had a small number of requests at any one time, but in recent months, the requests have definitely swamped that system. So far this year, MDH has received more than 33,000 requests for immunization records through the online form, more than 19,000 of those just since July 1st. For comparison, we received about 12,000 requests in all of 2020 and 13,000 requests in 2019. This means that the volume of recent requests means it has been taking weeks, not days, for people to get their vaccination record back. The Docket app gives Minnesotans a faster digital option to access their immunization history in MIC. In fact, I've just been told that over 1,600 records have already been downloaded since the app went live this morning. So that's 1,600 folks able to get their records right away rather than waiting for a long period of time. While many people we think will prefer the app and be well served by the convenience it provides, it is absolutely not required to use the app to be able to access your MIC records. Anyone who wants or needs access to their immunization record and does not want to use this app or does not have a smartphone can still request their MIC immunization record from MDH, as has been the case for many, many years, or reach out to their healthcare provider, who can also provide them with the records of any immunizations that particular provider has given. For more information, please visit our website at health.state.mn.us and look for Find My Immunization Record. Before turning it over to Dr. Lynfield, I just want to go back to give you a brief update on our ongoing data review work. As I mentioned at the top of the call, there are a number of cases in today's report that reflect the results of long-term quality assurance process that we do as a routine part of all of our infectious disease work to make sure that we're reviewing the data for accuracy and completeness. And that has been occurring throughout the COVID-19 pandemic. And we've seen several instances of kind of routine data reviews and updates based on those reviews. But the larger data review projects have been delayed due to just the immense volume of work, the duration and the size of the number of cases that we've been dealing with during this pandemic. But as we've had time, and we did have time, especially during that brief but wonderful window when cases were going down, not up, we were able to conduct more of these data reviews to update any complete or inaccurate data. A batch of cases and deaths from one of these data review projects for long-term care is being added to the data for today. These are not new cases. These are rather cases that have been waiting to be able to be verified as cases and now have been added to our counts. This data review project specifically to long-term care began earlier this year in early 2021. And you might remember that we reported on a first group of cases and deaths from this long-term care data review project this past March. And we communicated at that time that there were additional reports that required review. So these cases and deaths that are reported out today are the second and last batch of cases and deaths identified during this project. These reports were submitted by long-term care facilities to MDH through an electronic reporting system. So they were already known to us and treated as confirmed cases and acted upon by facilities and by our staff. The incomplete cases occurred when a facility reported a resident or a staff member as a case, but MDH did not receive a corresponding lab report. So MDH was not able at the time we received the report to verify the case or the death, but those were put into a pending review status. MDH epidemiologists reviewed all of the incomplete reports and ended up making more than 1,000 calls to long-term care facilities to determine which ones actually qualified as a confirmed case of COVID-19. This update adds 647 cases and 28 deaths to the state's total number of cases and deaths. All of these were specific to this long-term care review. So these are all long-term care resident cases and deaths. I do believe actually that, yes, the cases include staff as well as residents in long-term care, but all of the deaths were related to residents. And these cases and deaths occurred throughout the last 18 months. So they go all the way back to the beginning of the pandemic. But all of the total of all of the cases were reported in one batch in today's numbers, as I reported at the top of the call. These updates and notes are reflected on our situation update page and other online materials. I'm very thankful for the dedication of our staff who have such dedication to data integrity and transparency and go the extra mile over and over again to make sure that the data are the best and most accurate possible to inform public health policy and learnings about the pandemic. And with that, I would like to ask Dr. Lynfield to give us a quick update on what we know at this point about boosters for COVID-19 vaccinations. Dr. Lynfield.
Thank you very much, Commissioner Malcolm. There has been a lot of discussion in the media, and we have gotten a lot of questions about boosters. So I did want to let people know that the FDA Vaccines and Related Biological Products Advisory Committee is going to be meeting this Friday, and our understanding is that the Advisory Committee on Immunization Practices, which advises the CDC, is going to be meeting next week. And so we will learn more very shortly about the data, and their deliberations. Thank you. And I will pass it now back to Mike Schomer.
Thank you, Dr. Lynfield. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. Again, it's star then the number 1 on your telephone keypad to ask a question. To withdraw your question, please press the # key. Please stand by while we compile the Q&A roster. Our first question comes from the line of Jeremy Olson of Star Tribune. Your line is now open.
Hi, Commissioner Dr. Lynfield. These questions build a little bit off of your comments regarding the ability to track and trace the sources of infections at places like the State Fair or other places. I'm looking back at your last weekly COVID report. It's really most of the cases, new infections are unknown transmission sources, far more than in earlier stages of the pandemic. So we really don't seem to know where people are getting infected very well, and I'm wondering why that is. Have we dropped our contact tracing levels a bit? Are we just not able to figure out what this current wave is doing and where the infections are coming from? Something's going on with the data, and I wanted to know what you thought is happening.
Well, thanks, Jeremy. We can certainly go into that in a little bit more depth probably in a future call, but I'll certainly invite Dr. Lynfield to comment. But I think it's a combination of factors. It's that we are reaching a smaller percentage of cases through the case investigation and contact tracing efforts, both because of just the sheer volume, but also because fewer and fewer people are responding to the requests for interviews, and those that we are able to reach, either we don't reach them or we reach them and they decline to participate. And those we do reach really don't know because they've been many places and I've been doing many things and can't say with certainty where they think they were exposed. Dr. Lynfield, what would you add to that?
Actually, Commissioner, I think you covered it exactly. Those are the issues.
Well, as a follow-up, what are the implications of that? Does it matter anymore that we can't kind of trace the sources in this era where vaccine is seen as such a big part of the answer? Or are we losing something by not being able to do that as well as we once did?
It's a great question, and we would like to spend more time on that in a future call. I think there's still where we really want to focus our efforts is on making sure that we're getting all the data from cases where there are outbreaks and where there are variants, and in populations of special concern like long-term care and schools and child care and so forth. For sort of general exposures, at this point in time, we're not getting a lot of new data through that, but we do continue to get information out and need to get information out to people who may have been exposed, that they may have been exposed. It's just another good reminder that COVID Aware app is still a useful tool. And information is sent to primary cases for their use as well. So I think it's a really interesting question. There's probably more to talk about in terms of how the approach to kind of tracking what's happening on is kind of evolving as we're this deep into the pandemic.
And I'm sorry, quick question. Maybe I took a mental break. Did you mention the number of cases related to the State Fair and Sturgis, as those have been particularly closely watched?
Yes, the current, and we talked about the fact that these are just the primary cases, and we know not all of them by far. The latest numbers are 153 cases associated with the fair, including 4 hospitalizations, and we're still at 33 primary cases from Sturgis.
Sorry if I missed that. Thank you very much.
That's okay.
And Jeremy, I would just add that we think that those numbers are a significant underestimate for the reason that you brought up, which is that, and that was just discussed, which is that we are not reaching most people, and many people are not disclosing everywhere they've been. And regarding your question, there is a lot we now know about what we can do to mitigate risk. And that includes vaccination. It also includes when we have these levels of cases that people mask in public, indoors and outdoors, where there's crowding and where you can't keep a social distance, that sick people need to stay home, that people who've had exposures, and certainly people who are sick, need to be tested. And all the additional measures about improving ventilation, et cetera, we know how to decrease the transmission. And so identifying the exposure for every case when restaurants are open, when state and county fairs are open, we have provided the information about how to mitigate risk, and we really, really encourage people to follow those. Even though we do not have executive orders, that does not mean that those are not our recommendations. And so we really urge people to remember, we have a lot of COVID right now. It is raining COVID, and we need to do what we can to decrease transmission. Thank you.
Thanks.
Our next question comes from the line of Bill Werner of Minnesota News Network. Your line is now open.
Hi, thank you. Commissioner, one of my colleagues reported, I think a day or so ago, that the number of COVID cases over the last week, new COVID cases, 25% of them were breakthrough. And I guess this is a stupid question, but can you give us some sort of an idea of that percentage of breakthrough cases? Are those folks that are with compromised immune systems? Are they regular, I shouldn't say regular folks, but folks without underlying health conditions? And give us an idea of the risk factor and your level of concern about breakthrough and the efficacy of the vaccines, if you would, please.
Well, thanks, Bill. And I'll certainly ask Dr. Lynfield if she wants to comment on that, too. It is correct that we are seeing larger percentages of new cases being breakthroughs. Cumulatively, breakthrough cases represent a very small percentage of all the people who've been vaccinated, and an even smaller percentage of people hospitalized, and thankfully a very small percentage of people who've been vaccinated have had a breakthrough and died from the infection. That said, the breakthroughs are increasing. As you point out, 25% of the new cases have been breakthroughs. There's a larger percentage of breakthrough cases in people over the age of 65, which probably reflects, a couple of things, both the Delta variant itself and its different properties, and the fact that folks over 65 were among the first vaccinated and the longest out from that initial series of vaccination. So that's part of why we're eagerly awaiting these data from the FDA and CDC on at what intervals boosters will be recommended for different populations, perhaps. So I think in the case of the breakthrough cases, it is because there's so much transmission happening. As Ruth said, there's so much Delta variant around us. It is more transmissible. We don't know everything about Delta yet, but in terms of its impact on breakthroughs, but it's kind of a combination of how much there is Delta exposure, increasing exposures, much higher than what we've seen in the recent past, and potentially waning immunity due to time. So I think that's just, again, why the data that are being reviewed right now will be important to understand what that might lend to the insights and the response to the breakthroughs. Dr. Lynfield, anything else?
Thank you, Commissioner. I just wanted to add a couple of thoughts. One is when we look at the number of people who have been fully vaccinated, it's nearly 3.1 million. And we've had over 18,000 vaccine breakthroughs, but that's 0.61% of people who have been vaccinated, been fully vaccinated. So it's really important to keep that in mind. And then if you look at those who've been hospitalized, who've been fully vaccinated, that's 0.036%. And of those who've been fully vaccinated who have died, that's 0.004%. So the numbers are quite small. We participated along with 12 other jurisdictions in a CDC report that came out last Friday that looked at the rate of infections, hospitalizations, and deaths amongst fully vaccinated people and unvaccinated people. And it was fully vaccinated people were approximately 4.5 times less likely to be infected, approximately 10 times less likely to be hospitalized, and approximately 11 times less likely to die than unvaccinated people. So it's really important to be able to look at the whole picture. And I hope that helps demonstrate the effectiveness of vaccines, particularly against severe disease.
May I just do a quick follow? Thank you, Doctor. May I do a quick follow-up? When you presumably get, either for you or for the Commissioner, when you presumably get some indication from the CDC about booster vaccines, is the State Health Department in a position with the data that you have to then be able to establish guidance, or I don't know, priorities are necessary for those to minimize this amount of breakthrough? Are you in a position, do you have data to do that, or is it too early?
I think, Bill, if we'll be looking to the Advisory Committee on Immunization Practices, ACIP, they will be issuing those kinds of recommendations and guidances that are specific to who needs boosters at what interval. And I don't foresee that we would be doing anything different in Minnesota in terms of prioritization beyond that. But certainly that would just depend on how the situation unfolds. But really important for people to remember that we're just in a way different situation now than we were when vaccines first rolled out, when there was such limited supply. And the whole need for prioritization, was really kind of about that. With a very limited resource, how do you get it to the people who need it the fastest first? That's really not so much the case now. We have plentiful vaccine supply, and anticipate being able to administer the booster doses on whatever schedule is recommended to those who wish it. And to be able to keep on doing the primary vaccinations for folks who aren't yet vaccinated, which remains our top priority.
Thank you, Commissioner.
I also want to circle back on one thing. There were two other articles published at the same time as the one I quoted last Friday in MWRs, and I encourage you to take a look at those. One looked at the vaccine effectiveness against COVID-19 hospitalization, and overall it was found to be 86%. It was lower amongst adults 75 or above than those who were 18 to 74. So amongst 18 to 74 is 89%, and it dropped to 76% amongst the older group. Another study from 5 VA medical centers found a vaccine effectiveness of 87% of the mRNA vaccines during the period that Delta was circulating. Again, they did find it a bit lower amongst older people, where it was 80% among adults over 65, but 95% amongst adults age 18 to 64. So protection of 95% against hospitalization is quite high. So I don't want people to leave the call and just because we are seeing breakthrough infections to think that the vaccine effectiveness is not good. We think overall when you take the whole population and the elderly and the immunocompromised, it's lower, certainly, but these vaccines still appear to be effective against severe disease. Over.
Thank you very much.
Our next question comes from the line of Chris Magan of Pioneer Press. Your line is now open.
Hi, thanks. Commissioner Dr. Lynfield, I was just wondering if, given sort of the backlogs and data that have been reported as well as the holiday, there's been sort of a lot of noise in the data we've been seeing over the last week or two. I'm wondering if you could just sort of characterize how this surge is progressing, whether or not you feel like we've hit a plateau, and also just sort of what's been different. Obviously, there are a number of things with the vaccine about this surge in cases versus previous ones, but just wondering where you how you feel we are progressing with this latest increase in cases.
Well, thanks, Chris. You're right, I think, in observing that there's been some volatility in the data recently, and noise, as you put it, is a good description for kind of the impact of holidays and so forth. So it's that's just why we keep saying we need to look at numbers and trends over a longer period of time, and we tend to be focusing more these days on the week-to-week comparisons or 2-week to 2-week comparisons rather than the day-to-day to try to discern what the trends might be. We've been a little bit encouraged that the rate of increase seems to be slowing down, but again, that's really been sort of a short-term phenomenon where we're not sure how long that will persist, but we're still seeing increases. We've not yet peaked in the sense of hitting our maximum number of cases, and certainly the increases in hospitalization rates, which lag the increase in cases, are particularly concerning, with a pretty rapid uptick in hospital beds in use for COVID in the recent weeks. So I don't think we feel that we are at a plateau at this point in time. A few encouraging signals in the data, but way too early to say too much about that. Dr. Lynfield, what would you add?
I agree. Thank you, Commissioner.
Just to briefly follow up on that, I know we'll see the latest round of outbreaks in schools in tomorrow's release, but I'm just wondering, with the weather turning and schools now back in session, how long do you think it will be before those forces start to show up in our infection rate? Obviously, lots of people inside again with various mask mandates. I'm just wondering, what's your anticipation for when that impact will be seen?
Yeah, I think that's exactly kind of the reason for some of the concern at this stage of the game, is we start the school year at much higher community transmission rates than we were at last start of school year, and more cases among kids, as we've been reporting. So we've already seen, in the first week after most schools, and certainly some have been in session longer. I think it's the case, Ruth can correct me if I'm wrong, we saw about 100 cases a day reported last week, new cases in schools, and certainly that's a level that we've not seen previously. So that is a concern, that the cases among kids particularly, but also then transmission from those cases to families and community settings. So we would expect that would start emerging, pretty soon in the next couple of weeks. And again, we know that this is a something that happens in fall when kids go back to school. Lots of respiratory illnesses get kind of ticked up in terms of their spread. But in terms of kind of timeline for expecting to see much impact on the overall case rates, Ruth, would you say anything more specific?
Well, I would say we are already seeing increases. You're right, Commissioner, that last week it was about 100. We were hearing about 100 cases per day, but it has really shot up this week. Actually, it was more like 150 cases, I guess. We had 600 cases, more than 600 cases report on Monday, and yesterday had 500 cases. So this is on the way up. And, this is, we do expect it's going to continue to rise over the next few weeks.
Thank you both.
Operator, we have time for one more question.
Okay, our next question comes from the line of Catherine Reichert of Minnesota Public. Your line is now open.
Workers in the healthcare force than we did this time last year. Can you put any numbers on that?
I'm sorry, Catherine, we missed the first part of your question.
Oh,
I think you're
sorry.
asking about the kind of a more quantified answer to what's happening in the healthcare workforce. I don't have anything.
Okay.
Yeah, I don't have any statewide numbers on that. That's really just kind of a report from what we're hearing from individual health systems who are reporting, really significantly higher number of vacancies than they've ever seen before. So we'll try to quantify that better, but that's just such a consistent story from around healthcare and long-term care. We should emphasize that too, that they're just literally fewer staff than there were last year.
Okay. And I am wondering if you have any additional insight into whether the vaccine mandates outlined by President Biden last week will apply to teachers in Minnesota. I feel like that was a little bit up in the air last week. I'm wondering if you've gotten any further guidance on that.
I'm sorry, I don't have any updates on how that translates. We'll try to get back to you on that.
Okay. All right. Thank you.
All right, that is all the time.
And that's a wrap for today's conference call. Minnesota Department of Health Commissioner Jan Malcolm fielding one last question or two from our own Catherine Richard there. First of all, asking for quantification about what Jan Malcolm mentioned earlier in the briefing about Minnesota hospitals seeing some of the same pressures as elsewhere around the country. A lot of it due to extreme stress and burnout with fewer healthcare providers available. Malcolm was talking earlier about highest number of ICU patients in all of 2021 due to the state averaging now 2,300 cases a day over the past week as the Delta variant continues to drive infections in Minnesota. Not a whole lot of major news developments breaking out of this conference call today. We did get an update on the state fair situation ending a little over a week ago, and as of the latest report, there have been 153 cases of COVID-19, including 4 hospitalizations tied to the fair. The Sturgis Motorcycle Rally, that number standing at 33 Minnesota cases. We also mentioned the mobile app at the top of the briefing, and we got some more details about that to get easier access to inoculation records for Minnesotans for not just COVID shots, but other inoculations, immunizations as well. It's called Docket. Prior to now, Minnesotans would have to go to the MDH website for immunization records. The system has been swamped in recent months, however, so instead of taking just, it's been taking weeks, not days, to get records back, so this app is much faster. We have much more on the situation with that new app. We will have it posted on our website soon if it's not up there now, but we'll continue to bring you the latest developments on the air and online on COVID-19 and the rest of the day's news, including full reports on the major stories of the day coming up on All Things Considered at 3 o'clock this afternoon, 14 minutes from now, here on NPR News. In the meantime, let's rejoin our regularly scheduled program at this hour, the BBC NewsHour.
More than 400 facilitators like John